This can be quite complicated, actually, because as men get older, a few things happen. Firstly, the prostate can enlarge, and the prostate sits at the base of the bladder, and it can impede urinary flow. So men might notice that their urine flow slows down, and this can lead on to them losing their functional capacity. So if you like, the size of the bladder decreases, meaning they have to pass urine more often. Can be other problems though. The bladder can become weaker as one gets older and can become overactive. And working out what the underlying problem is can sometimes be quite difficult. Furthermore, there can be more systemic problems. As one ages, the body can start producing more urine at night. This is a condition called nocturnal polyuria. And we sometimes look for underlying causes of this to see if we can treat this as well. Well, all of those symptoms are very common symptoms of prostatic enlargement. There are other things that can impede flow, such as a urethral stricture, when there can be scarring in the urethra. And sometimes the bladder can become a little bit weaker, which means you will struggle to empty as well. Well, a lot of those can overlie each other. So, for instance, a urinary tract infection typically can produce localized symptoms like pain when passing urine, pain in the lower tummy, or just having to pass urine much more frequently. Produce more systemic problems as well, tiredness, confusion sometimes, and just generally feeling unwell. And you can develop sepsis, unfortunately, with urinary tract infections. Overactive bladder symptoms includes things like urinary urgency, having to pass urine very often. Now that can sometimes be caused by a urinary tract infection, but it can be a problem on its own. Bladder stones are slightly rarer. They often develop when people are not emptying their bladder properly. These can cause problems like blood in the urine or frequent urination and can impede flow as well sometimes. So you can see there's quite a lot of overlap between the different, all of these different conditions can actually produce some quite similar symptoms. Well, firstly, if there's an underlying cause, we could treat it. So if someone had an infection, we could treat that. Otherwise, if you look at non-medical treatments, sometimes some bladder training or physiotherapy can help with these conditions. They don't work. There are several different types of medication that are available to help with these problems. But normally, the first thing we would do is look to see if there's any underlying problem so we know what to target. Blood in the urine is nearly always a serious sign, and it's something we take very seriously. A significant number of people, particularly in older people, can have bladder cancer, and we do find that bladder and kidney cancer can present in this way. It can also arise from bladder stones, kidney stones, or indeed infection, but it's something you should always have investigated. Typically, after we've taken a history and examined someone, we would do a cystoscopy. So that's a telescope examination of the bladder to look inside the bladder to see if there's any unusual areas of tissue that might represent a bladder tumor. And then we'd represent some imaging of the upper tract, so of the kidneys and the ureters. And this could be an ultrasound scan or a CT scan.